Our final session of the day is titled ACO, Recipe for Success minus Accountability plus Competency equals Outcomes. Our speaker is an executive in professional services and the software sales arena, and has over 25 years of business and technology experience. Currently, he's a principal and thought leadership and member of our advisory services at Cornerstone OnDemand. He's currently serving as the principal consultant in change management, thought leadership, and advisory services. But prior to joining Cornerstone, he was the CEO and co-founder of the Sales Conservatory, where he specialized in helping sales leaders. This session will focus on how to move competency assessments beyond checklists and towards measuring behaviors which achieve desired excellence and quality patient care. I'm thrilled to welcome to the stage my esteemed colleague and friend, Dr. Tom Taunton.
Do I get to shake your hand?
You get to shake my hand.
Am I on? Thank you. So my understanding is that I am between a presentation, another yet set of presentations and drinks. Is that true? Thank you, TMA, for putting me in this spot. I appreciate everybody hanging in there, and it's been a packed day, and hopefully I will be not only educational and informative, but entertaining in this presentation. It's interesting how it all came together with me coming right after Edie, because she talked a little bit about engagement, and kind of allows me to maybe cut some of the stuff that I was going to present out. Thank you so much for the day and for everybody coming out, because if you weren't here, then I'd just be talking to myself. So that's me, and I always get introduced as Dr. So-and-so, but in the healthcare industry, I always have the joke, like my kids always tell me, but you're not a real one. And that makes me feel real good. So let's start. Up until now, you've had a great set of presenters to talk about all the statistics, about some of the challenges we have with talent management and recruiting and everything else that goes with it. But I'm going to make an assumption here at 4 o'clock in the afternoon, before drinks, that you probably all know that. You wouldn't be in the room if you didn't have that issue. And so what I want to do is I want to take it down from that global view, or that large macro view of talent and the world and millennials and all. And I want to talk to you as an individual. I want to talk to you as a person, as an employee. Talk about our behaviors, give you a little bit of history. I'm going to say some stuff that's not going to be on the slide. Hopefully you jot that down. And I'm hopeful that when you walk out of here, you'll have something to do after you have a few drinks. So let's start with what's common between accountability and competency. Why did I choose those words? So accountability is an individual view. When you're accountable, you stand alone. You have both the reward and the consequence that comes with it. It's different than responsibility. And so that's why I want to talk about this idea of each one of us being accountable and doing something that has what? An outcome. So Edie talked a little bit about business outcomes as well. And so what I want to do is say, you are correct. Both have behavior as its commonality. The idea to be accountable, I have to show you, and if I want to have an outcome, I have to show you. We're not our behaviors, but we are, but that's the only thing we know. That's the only thing I can see. You don't know me, most of you just met me here in the last 2.5 minutes. You don't know what I'm like, but you're starting to get it because of how I behave and how I present and talk. And so what I want to do is I want to go back to the early 70s, late 80s. So the 70s was just a great time for lots of things, like bad music and pants. But it was also a great time for social science. A lot of great questions came out of the 70s, such as, what behaviors do people do at work that are good and versus bad? And does that help me to know that, and what can I do about it? And so guys like me way back then decided, okay, we're going to ask that question. And we came up called something called organizational citizenship behavior. Blah, 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 big mouthful. We're going to call that good behaviors. And then people took it a step further and go, that's like employee engagement, isn't it? Because isn't that what I want to do, isn't it? Because when people say employee engagement, they connect it to good, right? Don't you want to have more of that? It would be a bummer if employee engagement was bad, then we wouldn't want as much. And so what it came up is we came up with these two flavors. Organizational citizenship behavior came in two flavors. They came in the compliance behavior, and that's the stuff I do for my job. That's the job description. It's not compliant like in harassment training. It's like I'm doing my job, and I got hired to do it. And I get to keep my job if I keep doing it. Good for you. But altruistic behavior, those are the things that are outside my job. Those are the things that I may have some other passion or some other skill that potentially I could help, or maybe even just more resource. Hey, look, I got some extra time. You want me to move your boxes from one side to the other? It's not my job. I got two arms. I'm strong enough I can move some boxes for you. So again, I say, compliance is being punctual. Everybody expects people to be punctual, deliver things on time. And then altruistic behaviors are being like helping other people finish projects. So which one do you think grows the company? Which one grows the institution as it pertains to better patient care? Better patient care, not patient care. Better patient care. Altruistic, correct? So here we are, beginning of February. Most of you probably are finishing up your performance appraisals. That right? Which one are you measuring? You're measuring compliance. Interesting. Because compliance is the thing we do that continues to do the thing we continue to do forever and ever and ever. And yet, what are the aspirations? We're going to grow by this. We're going to be better at that by continuing to do our job. Could it be possible that we're missing an opportunity here? Homework number one, as you're sitting down drinking whatever they're going to pour us, thinking about maybe my next performance appraisal should have a conversation about altruistic behaviors. So like anything that's worth doing is worth overdoing. These same people got together and said, wow, we're on to something. Let's slice this to death. And they took altruism and they said, here's some other ways that we can look at those particular behaviors. And now why are we assessing these behaviors in this way? Right? Because the idea is we want to grow, we want to do better. Right? That was the main question. And if I understand it, diagnose it, and define it from an operational perspective, hopefully I can then create an intervention that allows me to do that. So for example, right, the idea of courtesy, demonstrated courtesy by preventing organization problems through communication and consideration for others. So there's this case study of a hospital that was very, very profitable. Elliot Clark out there. But they had really low satisfaction ratings for the patients. And so what they did was they decided, IDEO is a great company that does this kind of stuff, decided to follow a patient. So the patient goes and signs up, and they go through every stage. So you get up there on some ungodly hour, 5:30 in the morning, for some surgery you're going to have 8 hours from now. And you sign in. Oh, not too bad, not too bad, not too bad. So finally goes to surgery, everything's fine. They finally get to the the place to rest. And what happens is they find out that literally every 10 minutes, somebody's walking into the room and poking this patient. I need some blood, I need this, I need that. And then the patient gets no rest. And what they do is they say, okay, but these are the things that have to get done. But then they looked at all the things that have to get done and said, could they all be done at the same time? And they said the answer was yes. And why isn't it be done at the same time? Well, I don't know when that person is going to go in. Well, what if you did know? Well, then I could go in at the same time. And so the only change was, let's be courteous to this patient. Let's understand where they're coming from. And let's all get together and poke at them, once a night instead of 18 times. That little tiny thing doubled their their patient satisfaction. It's an altruistic behavior. Still did my job, but this time I'm courteous. In my job description, it doesn't say, hey, and by the way, be courteous. But yet, if I took that perspective, and next thing you know, I'm growing, I'm doing better. And we all know what happens with better patient satisfaction. So, let's not get into the whole discussion about all of the different flavors. Let's just stick to these two buckets, make it nice and simple. So we have compliant tasks, part of our job description. They're motivated by what I have to do. I like my job, I get paid, I got stuff to do, and so what do I have to do? Here's my list of stuff, I'm being compliant. And sometimes, I get an atta-girl, an atta-boy that basically says, you did your job better than others. Okay, good. That's nice to have. It's not necessarily going to grow the organization or get any better satisfaction from any of our patients, but I'll take it. But then you have altruistic tasks, which is beyond the job description. It's motivated what I want to do. So you all have jobs in this field, and most of your job, I hope, is stuff you like to do. Some stuff you may not like to do, but you do it because that's part of the compliance. But there's probably other things that you would like to do and you think you're good at doing and might even be beneficial. Would it be interesting to share that with the institution? I happen to speak both Spanish and Portuguese fluently. It just happened to be. It's not part of my job description. But I told my boss that, and we now have a client that's coming up from South America. Now they're going to talk about something I have no idea what they're going to talk about, but I'm going to hang out with them because I'm going to speak Spanish with them and make them feel good. And you better believe it, I'll take credit if that deal closes. But hopefully it's a better thing. It grows, right? It adds to the experience. So again, I'm not going to belabor it anymore, but we have a disconnect here. We have a disconnect between what actually grows, whatever the grows mean to you, whether it be a revenue discussion or whether it be, satisfaction numbers, whatever that is. I'm using that all in one big bucket, as opposed to not growing, just being like stable, doing what you keep doing, right? The definition of insanity, right? Doing the same thing, expecting something else. Compliant behavior, that's what I expect, right? If you do the same thing, I keep doing what I get. Okay. So by now, you're thinking, all right, Tom, I get it. We need more of this stuff. These altruistic behaviors, this engagement, these positive behaviors. How do I crank it up? What dial do I turn? What analytic dashboard do I look at to get going? Well, let's take a look at some of those. So again, research, my buddies back in the 70s. After they come back from Studio 54, they go, well, let's take a look at what happens before altruistic behaviors. And there are basically 4 major categories of things that occur. Job satisfaction. So I have to be happy about what I currently do before I decide to go do something else. That makes sense, right? Check. Perceived fairness. Am I in an organization that's fair? Am I in an organization that will be recognized? Interesting book. I can't remember the title. It's by, Pat. He talks about active disengagement. And there are three major issues in active disengagement. Anonymity is one of them. Another one is irrelevance, and the other one is immeasurable. So people don't know who I am, what I do doesn't matter, and I can't even measure what I do. And that turns from basically, there's three stages, right? There's a stage of engagement, there's a stage of not engagement, you're just kind of neutral, and then there's the stage of disengagement, I'm actively not participating. If that makes any sense. And so what he's saying is those are the three things. And so that all can be boiled down to perceived fairness. Am I working in a situation where it's actually fair for me? Person-organizational fit. Do I fit? Can I do the job? And then lastly, my relationship with my leader, my supervisor, my manager, which is probably one of, if I were to rank those, that's probably number 2, that job satisfaction. The reason it's white is because that's what I want to dive into. The reason I felt compelled to tell you all that stuff was because, for completeness sake, I just don't have time to go through the whole thing. So I chose job satisfaction as being the thing I want to talk about. So, again, so how do I work on job satisfaction? What are those things? Now, there's lots of things, but what are the things that are most prevalent in this case? Learning and development growth, leader consideration, and motivation. Those are the three things that give me satisfaction. By the way, motivation can be boiled down to intrinsic versus extrinsic. I won't get into that. I see some heads nodding, so good. Talk to this young lady here if you want to know about that. But I want to talk about learning and development as growth. Because I tell you, I just did a survey, did an internal, I do a lot of my own research here at the company. And number one thing that came across when we were talking about what you can do to increase engagement across the board was more learning and development. I did like a word cloud. Everyone was familiar with those word clouds? It was like all these little words, and then development was like this big. So I didn't have to do much more analysis than that. Leader consideration, right? A good boss that listens. And then lastly, right, the motivation is what I want to do. So let's go into any questions so far? Because I feel like I'm transitioning to a new place. Yes, ma'am.
How do you counter the sentiment that the altruistic behaviors are what I've heard leaders say, fluffy and frou-frou? Those were the exact words, frou-frou and fluffy.
Frou-frou. That's a technical word. I wrote a paper on frou-frou behaviors once. So actually, they're not frou-frou, and I'm going to explain to you why they're not. I actually did a study. So at Cornerstone, part of our performance, and I've got some Cornerstone people in the room who are probably interested in what I'm about to say, or should be at least. We have this ability to give badges to people. Everybody familiar with that sort of social exchange? You did a good thing, and so I'm going to recognize you, and by giving you a badge, which is nothing more than a feed saying, "Hey, good job," But it's got this social implication, and so I figured, let me go. And by the way, it's public, right? So everybody can see it. That's the idea. So what I decided to do is I decided to measure all of the altruistic versus compliant behaviors that people receive their badges. So you get the person, you know what they do. Let's say they're a salesperson. And then you get all these badges, which is like, "Hey, Tom, great job on that, whatever." If that was my job, meant, good job presenting at, the conference in San Diego, I would chalk that up as compliant. So I'd just give it a point. If I get, "Thanks for those cupcakes," I may put, an altruistic. And it was very interesting to see that right now on a sampling base, it was 50-50. And so now what I'm doing, and I'm in the middle of this because it's a lot of data to get, but I'm now going to connect it to tenure. I'm going to connect it to role, responsibility, whether I'm an individual contributor or a manager, and it's now numeric. So I actually presented this to a customer because I had that same question. They said, I forget what it was like condescending to some extent. It's like, this is like kid stuff, And I said, well, yeah, it would appear so if you just let it sit there. But there's a lot of data. You can certainly turn that around. And that's one way. I'm just giving you an example. And so now we now have really good data to be able to say, okay, can I connect to the people's performance? This goes back to what Edie said earlier about linkage, right? The idea of saying if I've got altruistic and compliant behaviors that I've now quantified, and now I can connect it now to some kind of performance metric, whatever that may be, I bet you're going to find out that your altruistic behaviors are going to have an impact to those positive growth numbers. Has that removed the frou-frou from the discussion? That's an example. Good question, though, because frou-frou comes up a lot. So, any other questions? Because I've got this sense that we're now going to move into the healthcare part of our program, for those that are keeping track. All right, so why do we care about all this now in the healthcare? So if everybody believes in this behavior and how it all comes up and the fact that we can measure it and all this, why do we care? This is the statistic portion of our show. And I have basically deaths in the U.S. You can see the bold one that I'm trying to make a point here. Medical error. So this is the idea that I got the wrong information, I did something incorrectly, something that perhaps is not best practices. That alone, okay, that's a bad behavior we don't want. Okay. But there's an interrelationship with all of this. This idea that I move from competency all the way through, and I'm not going to read them all for you, but these are all connected. And so what we want to do is we want to get to the root, and that's competency, that's that behavior, right? Because the idea is if I can get the correct altruistic behavior, that assumes, right, that I'm giving you all of the underpinning of what it is to do your job, and you have an opportunity to grow and do some other things that might be beneficial. As a matter of fact, I bet you there's a bunch of extra talent in this room that isn't being used. And I guarantee you that in each of your institutions and organizations, there's extra demand that isn't being fulfilled. And if we all sat around and had a perspective of altruistic views, maybe not 100%, but certainly not zero, we could start fulfilling some of those demands that would actually grow and improve our situation in each of our organizations. Again, you can read all of that. I think it's, right, this will be posted somewhere. It's another healthcare case study. So, now I want to give you another concept. Remember I talked a little bit about we have these two different types of behaviors, and then we kind of backed out and says, well, how do I get certain behaviors to connect? And we figure, well, there's a learning and development component to it, so it's a development, something that we can do. But I often see that the term engagement used as our end goal has prayer and hope as part of the strategy. So, employee engagement, we have a survey, we send it out, and we pray and hope that it comes back. I was really nice to them, I remember. The fact is that it's a lagging indicator and not a leading indicator. And the only way we're really going to be able to get to the engagement that we want is understanding the leading indicators. So, just like the term may say, and this, by the way, this isn't new or revolutionary, but it's been revived by Chris McChesney, Sean Covey in a book called The 4 Disciplines of Execution, for those that are familiar with that book. Excellent book, by the way. Highly recommend it. I've seen Chris speak several times live. Very, very compelling, great stories. As a matter of fact, does a ton of work with healthcare. In that book, there's a bunch of case studies about healthcare. So if you need some good, some good fodder for your executive meetings, he's probably a good place to go. But the idea is the lagging indicator is the goal that we should measure. So in this case, right, we're talking about patient satisfaction. So hopefully we do a bunch of this stuff, whatever that stuff is, and we get happy patients or not. We don't know, right? We just kind of hope. But if we really start focusing on leading indicators and understand, and the leading indicators, they have to be both predictive and influenceable. I'm not sure that's a real word, but I'll use it. That means I know that that's going to lead to a goal, and it's something that I can do, that I can pull the levers and press the buttons to actually change. By definition, patient satisfaction, I can't change patient. I can't say, be happy, stop whining. Right? I have to do other things to maybe induce that. And I have to have what? Behaviors, accountability, competency to do that. Wouldn't it be interesting if we were able to then understand what are those things, like sanitary practices? So, but you understand that kind of concept? It's kind of a lens. Just an example would be like losing weight. Again, it's February, we're all thinking about losing a little weight. And the lagging indicator is the number on the scale. So if I wanted to know what that was, my measurement would be a scale. But a leading indicator might be what I eat and how I exercise. And so I know that if I eat a certain amount of calories, and I count that in my application, on my app on my phone, and I have a Fitbit or whatever it is, I can do, and those are all my leading indicators. So if I basically add those two things up, what I ate and what I exercise, and that's a smaller number, I hopefully somewhere along the line, my lagging indicator will be that I drop weight. So it's the same thing now. Superimpose that idea to say, okay, if patient satisfaction, employee engagement are lagging indicators, what might be my leading indicators? And if we're trying to improve people through altruistic behaviors, what might that be? Like education and training, does it make a difference? Incorporate knowledge into daily practice, right? Did staff competency levels increase? All of these things that you ask your question, these are all leading to leading indicators. And these are things that are very influenceable, like module number 9. That's a leading indicator. Knowing that I took that, and something that's not only predictive but influenceable. Hey, I can, guess what? Forget the other 21. Everyone do 9, and we'll work our way from there. But you wouldn't necessarily see that at first. But it's a different tool, isn't it? It's a different tool, it's a different measure. It's one that may be not necessarily congruent or obvious. Questions? I know we're getting close to the end. No, don't ask any questions. Just don't ask any questions. It'll just slow them down. I'm sure you'll have a story or something to tell. I get an opportunity to talk to lots of people. I'm just a researcher by nature, and every time I talk to somebody, I'm just gathering data. So if you and I run into each other and I ask you a bunch of questions, I'll probably be getting data for something. So, and you're just a subject in my little tiny studies. So, what's this gentleman look like? What's he appeared to be doing? Mopping, right? The floor cleaning. Asked a question. I said, I just said, hey, what do you do here? And he basically said, well, I'm actually the most important person in the hospital. I said, really? This ought to be fascinating. And he began explaining, he said, you might think that I mop floors and clean the place, but actually I am the person between, hospital-acquired infections and and a healthy person. And I have policies and procedures. I have certain behaviors that I have to exhibit, or else somebody may get sick or even die if I don't do my job. Hard to argue with that. So he takes the extra time, does the right chemicals and all the other stuff that you have to do. And it's almost inspirational to some extent. See how we move from that compliant view of things, where I'm sure if he just mopped the floor, he'd be fine. That's his job. I'm sure his job description doesn't say, and make sure that no one dies. But yet, from an altruistic view, he takes that extra step and sees the world in a different way. So I ask you, in your particular jobs, what's your altruistic behaviors? What are those things that you can actually grow and move the needle? Maybe those talents that you don't currently use. Any final questions as we wrap up today? Again, thank you so much for your time, and hopefully I was informative, educational, and a little entertaining. Thank you.